Welcome to our webinar on drugs and medications, what you should know. My name is Anjay Rastogi. I'm a nephrologist and pharmacologist at UCLA, and I'm presenting this program on behalf of UCLA Health and Core Kidney Program. The Core Kidney Program is a comprehensive program for care for our kidney patients. We have a website which I highly recommend you visit. And if you have any questions, you can email us at corekidney@mednet.ucla.edu or call us at this number, 310-954-2692. With that background, we'll jump into drugs and medications and why that's important. So I always say, as a pharmacologist, when you go to a surgeon, they do a procedure, they do surgery. When you go to a physician, we prescribe medications with the hope that this medication will solve the problem why you came to us in the first place. But there are a lot of steps that go between the diagnosis and actually the drug having the effect that we want. This includes getting the right medication. That's where the healthcare provider comes in. It includes dispensing of the drug. That's where the pharmacists come in. And then it's the patient factor that you take the drug properly so we get the right results. Now, what we do know is there are a lot of medication errors, and the errors can happen at any of the steps that I mentioned. But today we'll be talking about what the patient can do to make sure that we can minimize these errors as much as we can. Now, what is a drug? So let's start with the definition, and this I'll read it straight from the slide. A drug is any substance other than food that provides nutritional support that, when inhaled, injected, smoked, consumed, absorbed via a patch on the skin, or dissolved under the skin, causes a physiological change in the body. So that's our definition of a drug. Now, when you look in pharmacology, a pharmaceutical substance or drug, also called a medication or medicine, is a chemical substance used to treat, cure, prevent, or diagnose a disease, or to promote well-being. So that's how we define a drug or medication or a pharmaceutical medicine. Now a question comes up, how is a drug different from a poison? So the first would be the intent. So what is the intent of taking this chemical substance? But what we do have to keep in mind is that a substance that is given with well intent can also become a poison. For example, if the dose is too high, or if the drug is given too rapidly, or if it's an inappropriate medication, the medication should not have been given to the patient in the first place. All those things can convert a useful substance like a medicine into a harmful substance like a poison. So sometimes the definition is very vague between a drug and a poison, and that's where the drug errors and medication errors come in. And that's where the patient comes in, being your own advocate. So knowing more about medications, how to take them, and asking the right questions are very, very important. Now, when you look at a medication list, there are different groups or buckets that I put medications in. One is over-the-counter medications. These are medications that you can buy without a prescription. Now, a lot of people think because it's over-the-counter, these are safe. That's actually not true. A lot of these medications that are over-the-counter can actually be very harmful. For example, drugs like ibuprofen and Motrin, they can actually cause GI bleed, or we call it the stomach bleed, but also can cause kidney problems, can cause hypertension. So you have to be very careful. And when you go to your healthcare provider, you should always list the medications that you're taking over the counter as well, that we call OTC. Then we have the prescribed medications, which I'll be going over in a lot more detail. These are medications that you will need a prescription from a licensed healthcare provider in the US. Then we have something called herbal medications. Once again, these substances are considered to be supplements, and the thought is that they are safe, they're herbal, but that's actually a lot of times not true. Some of these herbal supplements can actually be quite toxic. So once again, make sure that you speak to your physician or healthcare provider before you take these supplements. And finally, last but not the least, is recreational medications. And marijuana, now becoming legal in a lot of states, is something that's coming up. And a lot of these substances that are quote-unquote used for recreational purposes can also be pretty harmful. So once again, these are substances that you should list on your list of medications or drugs that you're taking, and your healthcare provider should know about these, because number one, they can be toxic, but also they can interact with other medications that you're taking. So with that in in fact, like I said, medication errors are actually quite frequent, and there are some tips that we can follow to avoid this. The first one is keeping an updated medication list with you at all times. This is very important. You never know when you need them. It could be on your phone, it could be a paper, but whatever it is, you should always have it. And I'll be going over this in a bit more detail, what this list should include. The other thing that I always tell our patients is that whenever you go and see your physician or healthcare provider, bring your medications with you, because sometimes you'll be surprised that the same drug might be coming with different names and you're taking them, or you're taking drugs that you should not be taking. Also, you might be seeing different physicians, and sometimes there is no crosstalk between them. So it's always good to take your medications and give when you're being checked in, giving them an accurate list of the drugs you're taking. So when you see the physician, they have that medication list with them. Now, when you see your healthcare provider, make sure you tell them about any allergies, any side effects, or any adverse effects that have happened with drugs that you've taken in the past or that you're taking currently. And I'll be going over that in a bit more detail when we talk about allergies and drug intolerance. Also, if your doctor writes a prescription, make sure that you can read it, number one. And number two is you have read it in detail. And I'll be going over how to read a label once the pharmacist gives or dispenses the medication. Be proactive in your health. Like I said, nobody knows yourself better than you. So be very active and ask the right questions from your doctor and pharmacist. The other important point that I want to mention is the role of a pharmacist. They specialize in drugs. They know about drugs more than anybody else. So ask them questions and also ask them what's the right way to take medications. But always keep your healthcare provider in the loop if there is any changes that are recommended by the pharmacist. And then we also have the FDA website. You can go to FDA website and find out more information, especially if there are recalls or some more adverse events from any drug that you're taking is happening. Now, when you get a prescription, it's very important that you go over the prescription in detail yourself or with somebody else that you trust. So first of all, very common, is there a spelling mistake? So a spelling mistake in your name, a spelling mistake in the medication that you're taking. And these are the 5 rights that we speak about. First one, the right patient. So the name has to be right. The right drug, that sometimes small changes in names can come up with a very different drug. Right time, the right dose, and the right route. And the other one that I will add over here is the right duration. That is also very important, that how long the drug should be taken. Now, prescription labels. So let's go over this, to how to read a prescription. So first and foremost is your name. Just make sure that it's the right person, because if it's not the right person, then you need to really call the pharmacy or the physician's office to make sure that this either name was entered in error or it was somebody else's prescription. Then going one by one, look at the pharmacy name and address right over here. Make sure that the pharmacy name and address is correct. Number used by the drugstore is right over here. So look at the number. This is more for the pharmacy when they're refilling or filling the drug for the first time. We already spoke about the name of the person, Jane Smith or whatever the name of the person is. The name of the medication as well. Amoxicillin is over here. The right dose is 500 milligrams. It's taken by mouth 3 times a day for 10 days. So the dose, duration, everything should be correct. And if there are any refills, will also be listed over here. The doctor's name, the drugstore phone number, and the prescription fill date. This is also important. Look at the fill date. And then finally, look at the expiration date. So if the drug was given to you a while ago and has expired, don't take the drug. Those drugs should be discarded. Now, also let's talk about the medication itself. So what is the therapeutic substance, what we call the active ingredient? So when you look at a drug or medication, there are 2 big blocks or chunks of things. One is the active ingredient. That is the substance that actually is going to be helpful and is going to hopefully make changes in your body that will address the disease state. But then there are a lot of inactive ingredients as well, which I'll be going over in my next slide. These the fillers, these are the preservatives, coloring substances, and they too sometimes can have effect. So knowing the active ingredient is important. The product type, this drug is an antihistamine. It could be a blood pressure medication. It could be an antibiotic. Symptoms that this drug treats, look at those. This is also very important, just making sure that, once again, it's not a medication error. Then we go over warnings, when the drug should not be taken, or if you're taking the drug and it's causing symptoms, when to notify your physician. All these things are important. If you're pregnant or breastfeeding, a lot of these drugs can cross the placenta or are excreted in the milk, so it can affect the fetus or the baby, and some of them can be very toxic. So that's also is something important to keep in mind. The directions of taking the drug, the route, the dose, the dosage, the duration, all these things should be listed over here. And then the storage information, that is also very important. So if the drug is not stored properly, the drug can either become inactive or even sometimes become toxic. So make sure that you read how the drug should be stored, whether it should be protected from light, for example, what should be the right temperature, what should be the humidity. All those things are actually indicated in the label, and you should know about those. And then last but not the least is what we call the inactive ingredients. These include the fillers, these include substances that are used as preservatives, coloring agents. All these things are quote-unquote inactive ingredients, but sometimes they actually are not inactive because they can cause side effects or adverse effects, including allergic reactions. So those are important things to keep in mind. Also here, when we talk about inactive ingredients, these substances, especially for patients with kidney disease, can be a source of sodium, can be a source of potassium, can be a source of phosphorus. So that's also something to keep in mind and speak to your pharmacist and your physician if they actually are contributing a significant amount of these electrolytes or substances to your intake. Now let's go over the medication list, and this is very important. And when you make your medication list, this you can write it up, or you can use the Microsoft Word document or an Excel spreadsheet to get. But what would I, as a physician, want to see in the medication list that you bring to me? So first one is the full name of the medication. That should be there, and it should be the full name, because sometimes we have single pill combinations. There are actually multiple medications in the same drug. So I would like to know. So for example, if it's a drug like losartan hydrochlorothiazide, then I want to know both names, because losartan is one drug and hydrochlorothiazide is a different drug, and there are two drugs in that single pill. So I would want to know with the name of both of the medications, the exact dose, and put that in milligrams. For example, if you're taking a drug like losartan, 25 milligrams, 50 milligrams, or 100 milligrams, I would want to know the exact dose. And also, if you're taking the combination pill, then the dose of the other medication, for example, hydrochlorothiazide, 12.5 milligrams, that should also be listed. That's important when I would be making changes in your medication. The exact frequency, do you take once a day, twice a day, 3 times a day? That's also very important. The time of the day is also important, especially for drugs like that we treat blood pressure. Because when we treat blood pressure, or most of the disease states, we want a 24-hour coverage. So it's not just we take in the morning or in the afternoon or the evening. What's also helpful is what exact time. For example, if do you take it at 8 a.m., do you take it at 10 a.m., do you take it at 2 p.m.? That's also very relevant when I'm looking at your medication list. And also, if you're taking it empty stomach with food, or you're taking with other medications. So that also will be helpful to us when we are making appropriate changes. Then who prescribed your medication, and what was the purpose, and the name and specialty. So this is actually important, because a lot of times somebody else prescribes it, and they come to us and say that, can you just refill the medication, because I don't want to go and see this, or I'll have to make another appointment. And then this goes on and on and on. Then it becomes 6 months, 12 months, 2 years. And I'll give you an example of a class of drug that is actually the focus right now of potential adverse events. There is a class called PPIs, proton pump inhibitors, and there are different drugs. There's Nexium, pantoprazole, esomeprazole. All these drugs belong to the same class, and they're given for what we call acidity, reflux, and it should be used for a defined duration of time. But a lot of times they get prescribed by whatever physician you go to, and the patients have been on them for months or years nonstop, and this has actually led to potential adverse events with this drug. So it's very important when you list a medication to put the name of the physician who prescribed it initially and the specialty, and then also why was the drug prescribed? What was the purpose? Because same drug can have different purposes. For example, if you give a drug like losartan that I prescribed, it could be given for hypertension. It could be given for heart problems. It could be given actually for kidney problems, including proteinuria. So the exact indication why the drug was prescribed initially should also be listed in your medication list. Duration, that how long should some of the medications like blood pressures are for the life of the patient unless they get cured. Some of them are for short durations, for example antibiotics for a week, for 2 weeks. So the exact duration of the medication is also very important. And then last but not the least, allergies or intolerances. And as you can see, I differentiate between allergies and intolerance. Intolerance could be anything. You take a drug, your stomach gets upset and you throw up. That might not exactly be a true allergy. In the allergy, it's the immune system that gets involved. And this is important because when it's a true allergy, the next time you take the drug, the response will happen probably sooner. That's faster, and also it might be more intense. So the allergic reaction needs to be differentiated from just a pure intolerance. And I think that's something that you should also discuss with your healthcare provider and your pharmacist. Now, we spoke about this already, the active versus inactive ingredients. I won't go into too much detail, but these are some of what we call the inactive. The active ingredient is the medication, but that forms a small part of your tablet or capsule that you're taking. Most of the other stuff is that listed over here. That includes additives, preservatives, coloring agents. Now here, what's important, and the reason why I'm mentioning this is because even though they're called inactive ingredients, they might not be completely inactive. They actually can cause, including drug allergies, or actually, so sometimes when you say, for example, you're taking the losartan pill, and you get an allergic reaction, the question is, are you allergic to the medication or to some of these substances? The other thing that can happen with this is, as I mentioned, there could be a significant source of other substances, including sodium, potassium, phosphorus, substances that we want to minimize in patients with kidney disease and heart problems. So that also becomes important when you're looking at the inactive ingredients. We spoke about drug allergies versus intolerance. So when you have so first of all, talk to your healthcare provider and pharmacist and make sure that it's truly an allergic reaction. And if it's an allergic reaction, it should be listed in your allergies. And you should not take that drug, because like I said, the response could be faster and much more intense the next time you take the drug. The other important thing that you should mention in the allergies is what kind of reaction did you have? So did you break out in rash? Did you have tongue swelling? Those things are important for us to decide, but some of them could be minor, some of them could be major. So the exact type of reaction that you had, and a lot of times if it's a recall issue, that unless you write that down right away, you might not remember. So when the reaction is happening, also you might take pictures. If you actually have a rash, for example, you've broken out an entire rash there, you have these papules on your body that are rash, red and itchy, take a picture of that and show it to your physician with a different kind, because the rash that you break out in might not be a drug allergy. Might be an infection. It might be something else. So sometimes taking a picture of the rash is actually very helpful in showing it to your healthcare provider. Now, if it is a true allergy, your physician or pharmacist will tell you if there's any cross-reactivity or cross-sensitivity. For example, if you're allergic to penicillin, there is a 10% cross-reactivity with another class of drug that are used very commonly called cephalosporins. It also depends upon the kind of reaction, whether it was a rash versus an anaphylactic reaction in which your blood pressure drops and you can even pass out and have much more severe, or your breathing is impaired. So the type of reaction would also be important in deciding if you can use drugs from different classes to treat the condition. Then what should you do? So first of all, avoid that class of drug. But if that drug is something that you absolutely need, then you should see an allergist who can desensitize you from that allergy if it's possible. So once again, that is drug specific. So your physician is going to refer you to an allergist, immunologist who can look into it if they can desensitize if it's truly an allergic reaction. Now, this is just a bit of a pharmacology of a drug, what happens when you ingest. So the drug at the site of administration, if you take it orally, if you inject it, if you put a patch, it's absorbed, and once it's absorbed, it gets into your blood. And what's really important from or significant for us as healthcare providers is the site of action. For example, if you have an infection in the kidneys, what's really important to us is the drug's access to the cyst or the infection. Because if the drug doesn't get to it, even if it's absorbed, it's really not helpful. So for us, that the distribution is important. Then once the drug has done its job, it's metabolized. So it's actually acted upon by enzymes or different reactions, and is made into an inactive drug. And a lot of these reactions happen in the liver. So liver is what we call is a lab, chemical lab for our body. But these reactions can also happen in other parts of your body, including the kidneys. Now, once all this happened, the drug is removed, and kidneys play a very major role. So kidneys are very important in getting rid of the drugs that you take. And if you have kidney problems, then you will be either they will decrease the dose of the medication if it's cleared by the kidneys, or they might avoid that completely. So once again, that will depend upon the condition that's being treated and also the drug that's being used, and we'll try to use alternate drugs. Now also keep in mind, some of these drugs can be toxic to the kidneys. That's also we try to look at, and to avoid medications that are potentially toxic. And some of these medications I mentioned are actually over-the-counter medications, including ibuprofen and Motrin. Now these are some of the routes of drug elimination, and the big ones are kidneys, and then also liver. The liver and the biliary tract, they'll be removed by the feces as well. But there are other ways as well, and the important one is in milk. So if a patient is breastfeeding, then we have to be careful of if the drug is excreted in the milk, because that can definitely impact the baby. The other one is the pregnancy, because in pregnancy these what we call the pharmacokinetics of the drugs change, so the doses might change. And the second thing we have to keep in mind, if the drug clears the placenta, the fetus can be affected. So that we work very closely with OBGYN to make sure that we provide drugs that are not toxic to the fetus. Now, polypharmacy is very common, especially as you get older. The patients are on multiple medications, especially also if they have other comorbid conditions. If they have diabetes and hypertension and heart problems, the number of pills add up. And I think this, once again, gets important, that we keep an accurate and updated list of all the medications you're taking. So drug interactions can happen. So when you're taking multiple, when we give you multiple medications, 2 prescription, 3 prescription, our whole idea is that these medications work together and at least don't interfere with the other medications. But sometimes this can happen and can lead to some serious consequences. So the drug interactions could be with other medications. So when you're taking, and sometimes we try to separate them, we try to lower the dose, or if that's not possible, we try to give you another class of medication that might not have these drug interactions. The medications might interact with food. So if you take it with food or around food, the drug could be inactivated. So that's also something very important. They might interact with some of the supplements you're taking. So that's once again a very important reason that you tell your healthcare provider if you're taking any of these herbal supplements or over-the-counter medications. The disease state can affect it. I already spoke about kidney disease. Then there's liver disease, and there are other diseases as well that can impact the dosing and actually the toxicity of a medication. We spoke about single pill combinations in which a single pill can have multiple medications in it. And the type of effects, we normally want it to be additive or super additive and in a beneficial way. But sometimes they can be antagonistic. That means when you take two drugs, they actually minimize the effect of the other drug and make the drug ineffective. Or they can have toxic potential. So once again, these interactions, especially if you're on multiple medications, the medication list is very important. And the pharmacist is your good friend. You should talk to your pharmacist about these medications. And they should have the entire list of drugs that you're on. Now, factors that affect drug activity, other conditions you might have. You might have diabetes, you might have heart failure, you might have kidney problems, you might have liver problems. So those things, or you might be pregnant. All these things can affect the drug activity. So we talk about kidney and liver function. Age is also a factor. Extremes of ages, babies or elderly people, they behave differently and react differently to the same medication that you're taking. So that is something also taken. There are also gender differences between medications, between males and females. So that's body size. So somebody, if they're very small or very big, that also the pharmacokinetics have to be taken into account. Ethnicity, there are differences if Asians or Caucasians or Africans, that also is taken into account for some of the medications. And we spoke about pregnancy, once again, very, very important. How to take the drug. So if you don't take the drug properly, it might not be effective or actually might be harmful. So ask your pharmacist, should I take it with food? Should I take it with empty stomach? What's a multiple times a day? So sometimes we write 3 times a day, but sometimes we're even more specific, every 8 hours. So there's a bit of difference. When we say every 8 hours, it should be every 8 hours. It's not just any time in the morning, afternoon, or the evening. So talk to your pharmacist about this as well. Can I break or split the drug? That's the other common question that we ask. That's also very important. Some drugs should not be split, and that should be very clearly asked when you speak to your pharmacist. Can I take a lower dose? This is also very important. Do not take a lower dose or take less frequently or for lesser duration unless you talk to a healthcare provider, because this could have some negative consequences. For example, if you take an antibiotic and it's given for 7 days, but you only take it for 3 days, or take a lower dose. So number one, the condition might not be treated, but the second thing is that you might actually be promoting resistance to the drug. So it's very important that not to change any of these unless you talk to your healthcare provider and your pharmacist. Now, the FDA drug approval, I won't go into that, but we do a lot of clinical trials at UCLA in which we have a drug that has been studied first in animals or cells, then we get a lead compound, and then they go to different phases. They go through phase 1, phase 2, and phase 3. This is the final phase, and then the drug gets approved. It takes a very long time, as you can see, and we've been 10 to 15 years sometimes before a drug comes to the market. And for many of the drugs that are studied, they never come to the market. So it's a very long and tedious process. So as mentioned over here, there's a phase 1, phase 2, phase 3, and some of you might have participated, and we're very grateful, because unless we have participants, these drugs will never come to the market. As you can see, this is once we have a lead compound, it takes a pretty long time for the drug finally to get approved by FDA. Now, I do want to end up with a couple of questions that we get: brand versus generic version of a drug. So the brand is there's a pharmaceutical company or a biotech company that have studied the drug, have gone to phase 1, phase 2, phase 3. The drug is approved, and then it gets a patent. And this patent is given by FDA for duration in which only that company can make the drug. Once that patent expires, there are other companies, or even the same company, can make the drug under the generic version. That is called the equivalent or bioequivalent, and these are terms that you probably heard. Now, when we talk about generic drugs, you have to keep in mind the FDA still has to approve it. And and you should follow the same risks and drug label indications that we see with any brand name. Now, as far as the difference is concerned, so 8 out of 10 prescriptions in the US are now generic drugs, but they have to have the same quality and performance, and FDA does keep a very tight control over this. And some of these drugs are actually made outside the US. Now, what's important to keep in mind is that the generic drugs are bioequivalent. They are equivalent to the drug, and they have to meet certain criteria before they can be actually marketed in the US. The advantage is that they are much cheaper because they don't have to go through all these phase 1, phase 2, phase 3 trials, and also the marketing. So that's where the advantage comes in for these medications. So once again, they must perform approximately the same way in the body as a brand name, and they are lower prices. So that's the advantage of these generic drugs. Now, I do want to end this talk with drug recalls. There have been some drugs that have been recalled. Most of these are being manufactured outside the US. So when a drug is recalled, so you can go to the FDA website, they will have the list of the drugs being recalled, but the best thing is to call your pharmacy. Find out what the lot number was for that drug, who the manufacturer was, and they can give you alternate drugs. They can give you the same drug, but with an alternate batch or different manufacturer. And if they don't have that, they can actually give alternative medications names to you, which then you should call your physician or healthcare provider and verify that. But what I would recommend when I get these calls, I always tell them talk to your pharmacist first, because we don't have that information as healthcare providers. And once your pharmacist gives us, they can call us, or you can call us and we can call the pharmacist and find out more. But there are drugs and medications on recall, and you should be proactive about these. Now, I'll end up with, once again, UCLA Core Kidney Program. This is our contact information. And last but not the least, we are having our 4th annual kidney fair at Santa Monica Beach on May 5th, which is also happening to be Cinco de Mayo Day, and all of you should come. It's a fun-filled event where we also have a lot of education about your diet, about medications, about different disease states, including kidney disease, hypertension, and diabetes. And with that, thank you very much for your time. My contact information was on this slide. If you have any questions, please feel free to call us or email us, and I hope to see you on May 5th at Santa Monica Beach. Thank you very much.